Make sure you're grabbing it with underneath the cuff to put it on. Do not touch. Do not touch. Like once you've pulled the cuff, don't touch the cuff. Like this one, I can manipulate the glove and pull it like that, but I can't touch the cuff. I'm gonna pick this up in the middle and drop it. It's trash. Now I can manipulate my table however I would like. So some of y'all were asking when you were setting this part up about putting it on your sterile field versus not putting it on your sterile field. It's up to you. But just know that if you don't put it on your sterile field, you cannot touch this box with your sterile hand once you've done that, because it's no longer sterile. So just for the sake of ease, I'm not gonna put it on my sterile field. I'm gonna put it over here, okay? I'm gonna take my suction catheter kit out of here and I'm gonna put it in there. All of this can now go. It's trash, right? So I'm gonna grab my drape out of here so I can set up my sterile field. Shiny side down. So it's all down. So now I can start manipulating this however I would like. Don't need these. This is all sterile because it was in the kit. So I'm going to open it, and I'm going to open this. So I'm going to move this. I can manipulate this any way I want because I'm still sterile. Usually, like I said, I don't have that on there, so I can turn it where it's like that, and I can pour my peroxide, because my peroxide only goes in one, right? And then so I would throw that away. I'm not, because I don't want to. And then I'm going to do my saline here and my saline here, okay? And then it would be done. Well, actually it wouldn't. I'd have to put it in the, well, I can't do that. I would have had to have poured it in there before I put it down. All right, so then I'm going to check my suction. Everything is still sterile at this point. Both of my hands are still sterile, right? When do I become unsterile? The minute I touch that suction, right? So I'm done with that hand. When you connect these two, you have to make sure that none of these fingers that did not work out how I saw it. You have to make sure that none of these fingers on your dominant hand touch anything that your other hand touched or the suction tubing, right? So now what am I gonna do?
Lubricant high pressure.
Okay, I'm gonna test it, right? I'm reaching over my sterile field. So test it, make sure it works, wrap it back up, right? Okay, now what do I do?
Give breath.
Okay, I have to hyperoxygenate. So you're gonna connect. Okay, how many breaths do I give?
6.
Okay, then I gotta hold the faceplate and take that off, right? Now what? Okay, tubing's just not long enough. So I'm gonna go down, right? Keeping your tubing up taut so that you don't contaminate it. You cannot touch the trach while you're doing this. How far do I go in?
2 meters.
Y'all know what that thing is called? Carina. And so when you meet that resistance, you got to come back a little bit, right? Am I having suction on when I'm putting it down? No. How many times can I go? 3. And how many seconds at each time?
10.
Okay, so I'm twirling it out. Suction, suction, suction. And as I'm pulling it out, I'm moving my fingers up towards the tip of it. So when I pull it out, I don't fling it, okay? If I had to go again, what do I do next?
Hyperoxygenate and clean it.
Hyperoxygenate and clean it, okay? So that part is done. So now what would I have to do?
Dispose of that, change gloves.
I'd have to get rid of this, it's trash, right? I'm just gonna put it there. And I'd have to change gloves. I'm not going to because I don't have another pair, but you'd have to change gloves, okay? Now what? What do I have to do first? Take that out. Which hand do I use?
Dirty.
Your dirty one, right? But I have to be able to manipulate this and pull it out while holding the faceplate without touching the inner cannula, which can be really hard to do sometimes. Okay, now where does it go? The half and half, right? So when I put it in here, I put it in here so it's still standing upright some, so I can go back in and grab it with this, my unsterile hand. So I'm gonna grab it. Then you're gonna take this and you're gonna clean inside. You're gonna clean this way, clean the outside. This is gone, it's trash. Where does this go now? In my saline, right? Rinse, rinse, rinse. Shake it. Now what?
You have to clean his,
But I gotta put this back first, right?
yeah.
Because I can't leave that just hanging out. Or if I'm going to, it has to stay in the saline. You could either leave it here and clean,
Put it back.
or you could put it back. It's up to you. I usually just put it back, that way I don't have to worry about it. Make sure it clicks in place, that one does. This one would have a dirty dressing on. When would I have taken the dirty dressing off?
Before you put on your,
Before I put on the second set of sterile gloves, right? So let's just say it's off, okay? What do I dip this in? Saline only, right? Okay. Do I have to hold the faceplate?
Yes.
Okay. So clean under here, turn it over, can clean here, and then I'm done. And then I would grab another one, dip, clean up top, turn it, clean over here, done. Now what? Okay, I gotta dry it first, right? So hold the faceplate again, dry under here, turn it over, dry, done. Next one, same thing. You'll dry up top, and then you'll dry down the side. Now you're done. Now I can put this on, right? And after I get this on, am I sterile anymore? No. All right, and then how do we change the trach ties?
One side at a time.
So I would take this side off, put the new side on. So we'll just say, because I don't have another set. And then you would take the other side off, making sure you're holding the faceplate, and then you could put it back on. As I'm struggling to get it back in its place. Well, goodness gracious, y'all. Okay, so it's on, I'm done, now what? I gotta clean up everything, right? Gotta put the patient's side rail back up, lower the bed, all of that, right? Call light within reach
Document.
and document.